Hello, everyone, and welcome to the Coding Corner Medical Coding Education. In today's video, we are going to be talking about Find That Code, ICD-10-CM edition. In today's video, we are going to discuss the book layout, conventions and guidelines, how to locate the ICD-10 code with step-by-step instructions. We are going to find the documented diagnosis, determine the main term, look up the main term in the Index to Diseases and Injuries, otherwise known as the Alphabetic Index, find the code in the Tabular List, review all conventions and notes associated with that code. So let's get into it. So one of the first things that I want to point out is in your guidelines for coding and reporting in the ICD-10 book, you have section 1, conventions, general coding guidelines, and chapter-specific guidelines. Under that, you see that you have the letter A. So this is a further breakdown of the guidelines. So letter A is for your conventions. You have all of the structure and characters, abbreviations, and additional information needed. As you get further down, you will see there are specific guidelines to what you need to look for in the documentation. So you'll have use and. So the use of and is very important in that it will distinctly tell you what is important if these two words are together. So if it says diabetes and chronic kidney disease or hypertension and congestive heart failure, that might mean something different than if you are coding with the word with. Okay, so with means that it is associated with, could be due to, or in another condition. So just make sure that you know your guidelines. You also want to make sure you're paying very close attention to your excludes notes and other important sections, including default codes. That's something that we're going to cover in today's video. So there are additional conventions that you need to look at here. This is just a brief overview. Then you have letter B. Letter B now is general coding guidelines. So there are additional guidelines that are general across the entire book that you need to make sure you know. Remember, the guidelines are the bread and butter of coding. You have to know the guidelines and how to apply them to accurately assign a diagnosis. The next section that we need to look at is chapter-specific guidelines. As you can see, this is broken down to each specific section. So you have chapter 1, which is your certain infectious and parasitic diseases. These are your codes A00 through B99, and it also includes your COVID codes U07.1 and U09.9. But as you can see, it tells you all the details as to how to code these codes and the specific guidelines that apply. And this goes down through every single chapter of the book. So next up, what we're going to look at is how to pull a diagnosis and append the correct code. Okay, so we have our ICD-10-CM Index to Diseases and Injuries. This is your alphabetic index. This is very important. We always start in the alphabetic index and then we move to the tabular list. So let's look for diabetes. So we take our D section and we are going to look up diabetes. So now we have flipped to diabetes, and if you need more information on how to find that, obviously through the alphabet, but you can also check the bottoms of the pages to make sure you are in the correct section. Now we have flipped to diabetes. And as you can see, it says diabetes, comma, diabetic, and then it says mellitus and sugar. These are what we call non-essential modifiers. Mellitus and sugar mean that if you see these two words next to the code, non-essential modifiers do not change the final code choice. And then next to that, you see E11.9. Anytime you see a code that is next to the first word, or in this case, diabetes, for the condition, that is your default code. So if you are new to coding, you may not know that E11 stands for type 2 diabetes. There are different types of diabetes, including type 1 diabetes, and then there is diabetes that is secondary or due to another condition. But in this particular case, we are looking up the default code for diabetes, and E11.9 is our default code. And earlier I was mentioning the word with. So here you see the word with indented, and then you see additional conditions or manifestations that are further indented. So if your provider had have documented diabetes with cataracts, then you would have E11.36 instead of E11.9. So next we're going to look up an additional condition, and let's look up how we would find the main term and then find the complete condition from there. So now we're going to look up a urinary tract infection. So when you are looking up this condition, our main term is what is happening to the patient. So this is an infection. So our main term is the word infection. So when you're looking up a condition, what is going on with the patient? So in this case, it's an infection. Where is it located? It's in the urinary tract. So it would be infection and then urinary tract. So let's flip to it. Okay, so we looked up the word infection, and then we came down to the indented word urinary. And as you see, the word tract is one of our non-essential modifiers, meaning it doesn't change the end code. So our code is N39.0. Okay, so in this case, we are going to flip to the back of the book and we are going to look at our tabular. Our code is N39.0. So the first thing you want to do when you get to your tabular list is you want to look up this section. So for us, this code is in Chapter 14, Diseases of the Genitourinary System. And it is the codes N00 through N99. And again, I would like to recommend side tabs, as not only will it help you in real life coding, but it'll be especially helpful when you are taking the test. So now let's get to our N39.0 so we can look at the additional guidelines that we may need to follow. Okay, so now we have flipped to our urinary tract infection, which is N39.0. I want to make a couple points now that we are in the tabular list. So your first three characters are always what we call the category code. So in this case, our first three characters are N39, and it's other disorders of the urinary system. And next to it, you'll see this red box with a check mark. And in this case, this code requires a fourth character. So anytime that you see this little red box, it's going to tell you when additional characters are needed. And in some cases, we need up to 7 characters. So for our code today, we have 4 characters, N39.0. And when we come down to our code, as you can see, it's urinary tract infection. And this is when the site is not specified. So for our example, we did not have a specified site. So let's get down to the additional guidelines that must be followed. It says use additional code B95 through B97 to identify the infectious agent. So if your provider had documented the infectious agent, you would then look up an additional code from code section B95 through B97, and you would code that secondary to N39.0. We also have excludes one notes. So just remember, excludes one means never, ever, ever. So I'm not going to list them all, but as you can see, all of these codes, you will not bill with N39.0 together. Now that we have looked up a code from the Index to Diseases and Injuries, now let's look at the other tables in the index. First things first, we are in the Neoplasm table. So there's a couple of things to pay attention to for this table. So number one, you have where is the neoplasm located? So let's say, for instance, we are looking at the bladder. Okay, so you have multiple codes all the way through this row. So what's going to depend on the code you choose? So for this particular code for bladder or urinary neoplasms, you have different types at the top of your screen. So malignant means that this is a cancerous situation where it is or can be spreading. So the first column is malignant primary. So malignant means it's cancerous. Primary is the primary location of the cancer. So with cancer, you can have primary or secondary locations. So primary typically means the source. It means where the cancer began. So if it was a malignant primary bladder cancer, you would have C67.9, and as always, you would want to make sure that you are going to your tabular list to verify if there are specific coding guidelines for this code. Okay? Malignant secondary. That means it metastasized or spread to another location. Still cancerous, just it has moved to another location. Now, it can still be in the primary section and in the secondary section. It just depends on what the provider is treating on that date of service. So if it is a secondary, it's going to be C79.11. So when you have in situ cancer, it means that it is encapsulated in one specific area and is not spreading. So in this case, it is now, instead of a C code, it's a D code. So typically what you have is C codes are your cancerous codes, and D codes are your benign or non-cancerous. So it depends on the code, depends on the condition. So in this particular case, this is a cancer. It is in one specific encapsulated area, D09.0. So our next code is D30.3, and this is for benign neoplasm. Okay. Then we have D41.4, and this is for uncertain behavior. So let's talk about uncertain for a minute. So this normally comes from the pathology report. So if a patient has a biopsy done for this condition and the pathologist comes back that it is uncertain behavior, it means it cannot be determined. Now, cannot be determined and unspecified are not the same thing. Unspecified means that your provider did not give you enough information to correctly identify it at a higher specificity. Okay. Unspecified means you don't have enough documentation to pick a higher specified code. Uncertain behavior means they are uncertain. It means it is documented that it is of uncertain behavior. That is not the same thing, so make sure you pay very close attention to the correct code choice. So for unspecified, you're going to use D49.4. And remember, you are still in the index. So any of these codes that you choose, I would still recommend you go to the tabular list because that is the correct format for picking not only the correct code choice, but to make sure that there are not any additional code first, use additional, or excludes notes that are important for that code choice. Next, we are looking at the table of drugs and chemicals. So, similar to your Neoplasm table, now we have a substance. So, this is the drug or chemical that is causing the issue. So, let's say, for instance, for acetylcholine, you have chloride. So, if you go across your row, you have multiple codes to choose from. So just like with the Neoplasm table, you have different scenarios. So our first column is poisoning, accidental, unintentional. What this means is you've taken too much of the medicine. It has poisoned you, but it wasn't on purpose. So if it is ruled in that it was an accidental poisoning or unintentional, then your correct code choice is going to be T44.1X1. Now, if this was poisoning intentional self-harm, it means that you were attempting suicide with this drug or chemical. T44.1X2. Next up, we have poisoning assault. This means someone else is trying to poison you with this drug or chemical. T44.1X3. Now, poisoning undetermined is kind of like on the Neoplasm table, uncertain behavior. This means that the provider cannot determine whether the poisoning was intentional, unintentional, or assault. This is T44.1X4. Next, we have adverse effect. Adverse effect means you took it as appropriate, but you had a reaction to it or an adverse effect to it. T44.1X5. And then lastly, for this section, you have underdosing. This means your provider prescribed it at a certain dose and you are taking less medication than as prescribed. T44.1X6. And remember, just like the other index, you have to go to the tabular list to verify not only that you have all the correct characters, but you also are checking your guidelines to make sure that you're following all of the rules necessary to choose the correct code and additional codes as necessary. Our last index and section we'll be covering in today's video is the index to external causes. So this is a condition where something outside of you has caused this issue. So the example that we're going to look at today is a motor vehicle accident. So if your provider documents a motor vehicle accident, traffic, okay, and in this case, our code is NOS or not otherwise specified, meaning they didn't give us any additional information to pick a higher specified code. Then we have V89.2, and as you can see, you have this check mark here that's telling you additional digits are required. This is not a complete code, so make sure you verify that once you get to the tabular section. As you can also see, is that there is one of our guidelines here, see also. See also means that you can also find this code if you look it up by accident transport, and you will still get to the correct code choice. So if we were looking up this code, we would then need to go to the tabular list to get our additional digits. So let's go there. So now we have flipped to the tabular list and we have found our code, V89.2. And as you can see, next to our code, we have a blue box now that says a 7th character is required. And if you want to look back to this, first you have your main term or your category code, V89, motor or non-motor vehicle accident with type of vehicle unspecified. And it says it requires a 4th character. Well, our 4th character is 2. So our code is V89.2, but as you can see, we need the 7th character. Well, where are the additional digits coming from? Now, if you have already begun your journey in coding and you have reviewed your guidelines, you know that we have something called placeholder digits. So placeholders are the letter X, and this basically holds the place for additional digits to get to the full 7 characters. So in this case, you would have V89.2 XX, and then it requires a 7th digit. So the 7th digit will be at the top of your page or your top of your section for that category. Now, for argument's sake, I'm just going to show you this box below it, but this same box is going to be at the top of the V89 section. So you have A, D, and S. A is for an initial encounter. D is for a subsequent encounter, and S is for a sequela. So A means that they are currently doing active treatment. So think of A as active treatment. Okay, it does not mean the initial encounter as in the first time they're seeing the patient. It means they are actively treating this motor vehicle accident. Then a D is a subsequent counter, or what I like to call delayed, meaning it's not actively being treated, but it's healing. So if the condition is in a healing state, then you're going to apply the D. Then S is for sequela. So sequela means the motor vehicle accident caused another issue, and that issue still lingers on after you have finished treatment for the motor vehicle accident. So let's say you had the motor vehicle accident, it caused a shoulder fracture, and you are still being seen for a shoulder fracture that was due to the motor vehicle accident. Or if you had another condition like a scar, or if you had movement issues like monoplegia or hemiplegia or quadriplegia, that is what we call a sequela. Those usually come with a stroke, but it's another example of what a sequela would be. It means that once you finish that initial treatment, this is something that continues to affect the patient past the initial motor vehicle accident. So in our case, for example, we're going to say that this patient is in active treatment. So our complete code would be V89.2 XXA for initial encounter. And that's going to complete our code. Now, that is also going to complete today's video. I hope that you enjoyed it, and I hope that this was helpful to understanding how to assign an ICD-10 code, and we will see you in the next video. Thank you so much and have a great day.